With respect to our speakers this morning, they are veterans of this conference. They have been here for many times, and I hope they will, and I'm almost certain that they will give you interesting presentations. The first one is Professor Hashimoto from Japan, and aside from his impressive academic record, I was very much impressed over all these years how he came here with students of his, and he used this conference as a part of an international education of his students, and the way he interacted with his students and the way the students presented their papers and so on. This was for me very interesting to see, and the floor is now open to you, Professor Hashimoto.
Good morning. Today's talk is based on my experience. First slide shows my affiliation. I started my professor work at Tokyo Institute of Technology, Mechanical Physics, and the professor work changed to a medical school, Kitasato University, Japan. And Osaka Institute of Technology welcomed me to take a professor work in electronics department. And I created Biomedical Engineering department in Osaka Institute of Technology, Japan. And now I come back to Mechanical Engineering department in Kogakuin University. I myself took a very important experience when I was a student. That was 1977. I took an internship abroad, and the place is Berlin, and the Institute of Artificial Heart. Speak about research work. I started with mechanical engineering, and I switched to a medical university and did artificial heart and blood flow study. And at Department of Electronics, I took research work on biomeasurement. And in 2005, I founded the first department of biomedical engineering in Japan, and I started research work on cell and tissue engineering. And now, my professor work in Kogakuin University, Japan, started 2011, and my field work is biomechanics now. Speaking about collaboration with medicine, with thoracic and cardiovascular surgery, I took a study on artificial heart, artificial lung, and I studied on artificial joint with orthopedics, and research work on artificial vessels with plastic surgeon, and shunt design with neurosurgeon, and also study on laryngoscope with anesthesiology. And just let me speak about my affiliation. Kogakuin University was founded Mr. Hiromoto Watanabe, who is the first president of Imperial University of Japan, and he made a variety of societies to make communication among multidisciplinary fields. He established Kogakuin University, which is one of the societies for education of engineering. That was 1887. And Kogakuin University is located in Tokyo, the capital of Japan, and you see behind our skyscraper building, you see Mount Fuji, and our campus, we have another campus in outskirts of Japan near Mount Fuji, and we enjoyed cherry blossoms in spring and color leaves in autumn. We have a research center for micro and biosystems, and the Kogakuin University has very nice facilities for micromachining and for cell culture. And our university collaborated with School of Medicine and School of Pharmacy. So our university is concentrated on technology. And Kogakuin means Institute of Technology. So we cannot translate Japanese name to English name. Otherwise, you cannot distinguish with Massachusetts or California or Tokyo or so on. So we just say Kogakuin University. Today's topic is how to learn multidisciplinary ideas. You already know that segmentalization of learning occurs, so each field has been separated each other, but sometimes we need integration for multidisciplinary problem. I exemplified biomedical engineering field. Biomedical engineering field includes science, biology, pharmacy, medicine. Also, it includes related to economics, sociology, ethics, and religion. What is learning and what is communication? We look for we should find common base to communicate with someone. And how do we make motivation? How do you get curiosity? I would like to point out cross-cultural communication. If you take cross-cultural communication, each culture has its background. So backgrounds quite different between cultures. If you come back to universal tool for communication between fields, for example, engineering and medicine, what will you use? Language is enough or not? If you be a scientist, you know drawing, figure, mathematics, or unit is very convenient to be a universal tool for communication. So I started annual cross-cultural student seminar on biomedical engineering 2011, and each year several students join in this program. How do you free from prejudice? Variation of academic background of students is pointed out here. The students come from a variety of fields: mechanical engineering, material science, electronics, environmental engineering, nursing, dentistry, and pharmacy. So we choose some topic for student exercise. Last year, we chose the topic of visiting the hospital. The hospital is a place where many kinds of specialists are joining to accomplish the medical treatments and the health care. Because the university hospital is very big and has complicated system, it is not easy for patients to find a way to receive better consultation. The visiting the hospital might be good exercise for students to get multidisciplinary idea. The slide shows the King Chulalongkorn Memorial Hospital in Bangkok, in Thailand. So, students started with interview in the hospital. They try to make interview to patients, sitters, and medical staffs. Japanese students cannot speak Thai, so Thai students help them to translate from Thai to English. Medical staff is sometimes too busy to accept the interview, but outpatient has enough time sometimes because they have to wait for a long time to receive medical care. I show you 4 examples. The group A choose medical instrument, so they visited radiology section. After the interview, they pointed out several topics to be solved, and the humid control system, the software to make the position of tumor, and simple interface for the operator. Group B choose reducing waiting time of the outpatients in the hospital. How long do you spend for each process? Registration, diagnosis by a medical doctor, special investigation, payment, and getting drug. And they proposed registration system on the web should be a topic to discuss. Group C choose device to improve the quality of life of the patient, and they make some proposal design. One of them is leg extension for congenital shortening of Achilles tendon, and cane to run at the time to fall for tumor at her knee joint cases, and wake-up aid for paralysis. Group D tried to find device for patient with cardiac problem. According to the prediction after fieldwork, warning device for cardiac problem was the topic which they choose. After the program, student impression of group work was through presentation was serious. Though presentation was serious, the discussion was interesting. I've never experienced this kind of fieldwork, and the group activity was very exciting. The exercise stimulated me to study English, and I will join again. Another program is presentation training and laboratory visit. This case, The slide shows the program in Mahidol University in Thailand. And this slide shows laboratory visit in UIC and Northwestern in the United States. Student impression of laboratory visit is, I won't forget your passion as a researcher. Laboratory tour gave me new idea. High-level research stimulates me to continue the research. I want to study more about biomedical engineering. I learned essential expression and effective presentation. And the communication is not easy between people of different cultural backgrounds. Language is not the only tool for communication. May I switch to a presentation in WMSCI? I attended this Congress from 2000. And the data shows the number of students participated in this WMSCI conference from 2002 and this year. This year, 6 students will join in the last day of this conference. The topic will be included in Biomedical Engineering 1, how to this topic and adjuster for repeatable targeting local part of cell at a stage of microscope for biochemical analysis. Deformation of cell passing through the microslit. Culture of myoblast on conductive field with electric pulses. Culture of myoblast on microcoil spring with electric pulses. Microgroove for trapping of flowing cell. And in the afternoon session, rotating this to apply wall shear stress on cell culture at microscopic observation. Effect of wall shear stress in flow on myoblast. Effect of electric stimulation on differentiation and hypertrophy of fat precursor cells. Effect of excess gravitational force and electric pulse field on myoblast. Effect of ultrasonic vibration on proliferation of cultured cell. Behavior of cell on vibrating microridges. And WMSCI World Multi-Conference on Systemic Cybernetics and Informatics gives good opportunity to learn multidisciplinary idea because it welcomes not only variety of special field of study, but also variety of researchers from variety of cultural backgrounds. Many academic conferences are concentrated into special field so that number of participating countries is limited. Although specialized group is convenient for peer review, it is not almighty for global society. Global society consists of a variety of elements. Single discipline is not enough for application to global society. Multidisciplinary idea breaks through global problem and creates innovation. I choose these numbers from proceedings of WMSCI, and each year, big number of countries you can find out. So it is good stimulation for young students to join the multi-society in WMSCI, and WMSCI supplies multidisciplinary society and cross-cultural society simultaneously. At the beginning, students tend to pay attention to the language itself. But after the seminar, students found it is not so difficult to find out the rule, but difficult to understand the background. The common background of biomedical engineering helps them to find a way of thinking. These discussions is not only for students, but also professors. So, cross-cultures multidisciplinary seminar for students has been exemplified, and the way how to learn multidisciplinary idea has been discussed. Students from a variety of backgrounds of research area and culture have joined in the program. Through the training, students realized another way of thinking, which stands on another base of idea. So the process is effective to educate multidisciplinary concept. I thanks to Dr. Mana of Sri Lanka University, Dr. Jack Reed of Mahidol University, and Robert of Northwestern University and Richard of UIC for collaboration to our project. The slide shows references. Thank you for your attention.